would like to invite Professor MUKHTAR Al-HASHIMI and Micheline Ahlia to talk about their paper, End User Satisfaction with the Quality of Innovative Healthcare Technologies in Bahrain. Thank you.
Good morning, everybody. My name is Professor MUKHTAR Al-HASHIMI, and this paper is me and one of my students, Miss Micheline. Miss Micheline, she apologized for coming because she's at work. So I will deliver the talk on her behalf also. The talk is about the end user satisfactions in healthcare, innovative technology. We are looking at the case of Bahrain with respect to the hospital information system. As you know, healthcare and technology has impacted our life in all its aspects, and healthcare is one of the areas has been impacted. We're looking at the hospital information system, and hospital information system is one of those innovative technology that has revolutionized the healthcare model. By definitions, hospital information system is a system that incorporates clinical, administrative, and financial aspect. It leads the healthcare authority to produce data for the decision-making and healthcare quality. In Bahrain, we have different experience of healthcare information system. First, it started in 1994 by the development of Al-Care. It has the privilege that I am one of those guys who have developed the system, and it is in-house system and is still functional. This system has been developed in the military, and then it's been transformed to King Hamad Hospital, where also we have another experience by adopting a Spanish system called ANDRA, and that is in the Ministry of Health. With respect to the healthcare private, each one of them has his own different spectrums of healthcare system. So our study is looking at how users satisfied with these systems with respect to different dimensions: system quality, information quality, and service quality. In doing so, we looking at the importance that for users to use the systems, they have to be well satisfied. And once the systems has meeting the user's expectation, it's going to be very functional. It will be increasing productivity and performance. As you see, the system quality has a different domains and factors to be measured: ease of use, interface, system speed, reliability. When it comes to information, quality is information, relevance, accuracy, integrations, and timeless. When it comes to service quality, the emphasis on the measurement is the training, support, frequency, and availability of the system. As we know, hospital information system is a very costly, it costs a lot of money, and it's basically impacting the healthcare process. Therefore, there is a gap to measuring it. We conducted this study by looking at different hospitals in Bahrain to measure the user satisfactions, the end user satisfactions with respect to those three elements. Such a study will contribute to the healthcare authority and the decision makers, and to also underline the importance of the healthcare players, such as the users. There is a huge literature in this area, and I will not bother you with it, but all the literatures emphasize on the importance of user satisfactions by measuring it, looking at how the end users are perceiving each one of these factors. Upon the literature review, we have adopted the Dolan-Macklin models 2003. And this model is very widely used by different literature, and we thought to use it in order to compare. The emphasis on the model is based on system quality, information quality, and service quality. All these three factors construct will deal with and contribute to the user satisfaction quality. Upon that, the hypotheses were developed, and the hypothesis straightforward. System quality positively affect the user satisfactions. Information quality positively affect user satisfactions, and service quality positively affect the user satisfaction. When you translate these into what we call them the variables, these construct, and you demonstrating them in a questionnaire. So we looked at the 7 hospitals, which is basically the populations, reflections of private and public, and we look at the end users who are basically participated. They are physicians, nurses, healthcare administrator, pharmacists. At the same time, the sample was about 325 valid questionnaire. That we used the questionnaire adopted from previous study using Macklin models, and we analyzed the data SPSS and reliability and Krompa alpha 0.938. The hospitals that we have studied, we are not able to mention their name, but they are good reflections of the public and the private. Majority of the participants come from a public. At the same time, we have a good representation of the data. Although it's difficult to obtain all the data from some hospital because of the regulations, and you need to get approval. Majority in the finding, the majority of the finding of this study is a reflections that the majority of the participants come a female, which is a true reflections in the healthcare industry and services, and they are within the age distributions, which is again a good reflections of what's reality. And then non-Bahrainis make about 66% of the participant, and this is again the reflections of the reality of the people who work in the healthcare. We got a good spectrums of results from physicians who participated, pharmacists, lab technicians, different kind of people. Interestingly, when we asked the users about their use of the systems, majority said that the systems has been implemented is between 1 year to 5 years. But in reality, many of the systems in this country is being implemented, the majority, especially in a private hospital, within that range of 1 to 5. Training happened to be only once has been given. Majority has responded to that. Reliance on paper. Many of the hospitals still believe that they are relying on paper, and hospital information system has not really become what we call a replacement to the delivery model charting. Upon reflections of our findings with respect to the theoretical models that I have presented to you, we see that for each of these constructs, which is the 4 constructs, it goes system quality, information quality, service quality, and end users. The average mean for each one of these is very high, although when it comes to remote connectivity, it's kind of low. Upon that, we done the regression analysis, and we done the hypothesis testing, in which all the hypotheses were accepted that there is a positive relationship between system quality and user satisfaction. Same goes with information quality and user satisfactions, and service quality and user satisfaction. Upon that, we can draw a conclusion that there is a strong relationship, significantly, between all these parameters, the 3, with respect to the user satisfactions of health hospital information system in this country. The conclusion. I guess this is the shortest presentation I ever given. The conclusion, okay? Now I'm getting trained to give short presentations. The conclusion is basically, upon our finding, we could see that all these indicators are positively with a higher mean. And this means they are all positively correlated and significantly. However, many of the users, when they participate for hospital information system in the public and the private, they show a concern with respect to remote connectivity. That means, although there is a hospital information system, they differ in their functionalities, they differs in their objective and alignment to the organization. However, many physicians in these days, they like to have access to the hospital information system remotely, which is a lot of hospitals, they don't have such services like that. Therefore, one of the recommendations of this study is that it's need to have more emphasis on remote connectivity using a smart technology. All the hypotheses also underline that there are a strong relationship, but however, for us to continue on improving the hospital information system, we must understand the emerging technology and the scope of functionality when it comes to hospital information system. Any organizations want to implement a hospital information system, it has to keep in its mind, it should not align the hospital information system to operational activity. It has to align it to their strategical objective. Doing so, a good hospital information system has to incorporate decision support, alerting, costing, and monitoring. Based on my experience in this field for the last 25 years and a core developer of hospital information system, we have achieved a very good experience in this country. It's an in-house developed system where we are able to calculate the cost of service by creating an equivalent to the DRG equivalents for healthcare delivery. Upon that, we are able to understand how much does it take to deliver a normal delivery in a given hospital. Once you know how much do you need to do for an operation based on an ICD code, you will be able to develop what we call an insurance scheme. And once you know how much does it really cost, you know how much really you need to reimburse in insurance. There is a big need to revisit the training, and the training because in this study underlined that majority of the users, they basically have one-time training. Therefore, there should be a periodical training, and this training has to be part of the appraisals. With the reality whether the hospital information system will replace the paper in this study has indicated no. It's reality that those two systems still exist in this country. There is a need to make sure that any automations have to lower the cost of paper model. Upon this study, there is a need to look into what we call decision support and also to align the hospital information system to a clinical information system and using what we call lately innovative technology like a robot. I would like to thank you for my presentation, and I will be happy to take any questions. Thank you.
Thank you, Professor. And I'll now pass to Mohammed Hasmini, who will take questions from the floor and conduct the next part. Thank you.
Thank you, Professor
Thank you.
MUKHTAR.
Yeah.
We have some time for a few questions, probably 2 or 3. So, let's wait for the mic so everyone can hear the question.
Now, these results that you got and the satisfaction, what will happen if the patient dies?
You know, when you develop a system, especially when it comes to a medical informatics, when you develop a system in medical informatics, based on my experience, you are dealing with the really life of a people. So in this case, the deployment of the system and the testing of the system will take longer time. For example, when you want to automate the laboratory and biochemistry, so before you deploy it, you have to make sure that it is well certified, it's well proven, and it's been all recognized by all the parties. In this case, you have to do a lot of testing, and that's based on my experience when I develop a clinical information system. Some of the modules we have to test it for 2 years and has to be tested by different party. So and that's one way you can say that you want to eliminate the idea of patient die. Thank you. Next. Please, Doctor.
It's about the second conclusion in the paper.
Yeah.
It's about the connectivity thing.
Yes.
What did you exactly, how do you define connectivity?
Yeah. When we talk
and I have another question because of this.
Sure.
Right? Please.
When we talk about connectivity, we're talking about remote connectivity. That means a physician can access his patient records from his home or from his smartphone. Doing that, some organization will not authorize that. And the reason is that because you need to make sure that whoever is really connecting is the right physicians. There are a lot of technology which need to be incorporated. But physicians right now, they are pushing for that. Because if everybody is having a smartphone and everything.
I got the point, but this is not under control. I tell you why. Now, if you are my physician and I'm your patient, I could send you my data to be checked by you as a physician on the WhatsApp, and I get the result, the answer from you on the WhatsApp.
Yeah, but
this has nothing to do with the official system of connectivity.
No,
it's outside connectivity. It is a connectivity of something very special. So still, this thing needs to be more researched. And you notice the 2.78 mean score is really low. I mean, if this is because of the systems don't allow.
Those systems don't allow connectivity.
But it is operative on the other side. In the
Some systems, for example, the system in the military, the one I have developed, they have a functionality of open connectivity. We develop it from the beginning. But because we need to get, basically, to make sure that it is secure and it is the right person and in the right place, that's an issue.
Thank you.
Yeah.
I would like to call Professor Mansour Al-Ali and Professor Allam to give a token of appreciation for our keynote speaker, Professor MUKHTAR.